people you're seeing here, to my immediate left is Dr. Robert Verkerk from the United Kingdom. He's the scientific director and founder of the Alliance for Natural Health, which has taken on the Goliath of the Parliament, European Parliament, and Codex. And those of you who have read my articles on Codex will be pleased to know that the source was always Dr. Verkerk, who gave me information as the years went by with great patience and dedication. The mistakes are mine, but the source was Dr. Verkerk. The next person is Dr. Shiv Chopra, who hardly requires an introduction. He's Canada's food safety hero. If he wasn't around and hadn't withstood the pressure of the various prime ministers of Canada who had other agendas, we would have bovine growth hormone in our milk and even a higher cancer rate than we already do. And that's only one of the drugs that he made sure did not get into our food supply. The third person, some of you may have already heard, is Sean Buckley, the lawyer who worked first with Health Canada and then against Health Canada and won the famous True Hope case. So people who have read my book, What Part of No Don't They Understand, which was on Bill C-51 and C-52, which has now returned as Bill 6, will have read the information on the True Hope case and how the Canadian government tried to basically stop life-saving research and stop an entire medical trial, and how Sean Buckley won that case on behalf of patients.
Okay, the subject that we are now going to deal with today is what is industry and big governments up to. I've been at this game virtually all my life, since I graduated. I worked in industry, worked in England, pharmaceutical company, joined Health Canada, worked there for 35 years, and saw some horrible things. There has been unrelenting pressure from the chemical companies to pass products that are unsafe. They may be drugs, vaccines, medical devices, cosmetics, and finally, the food itself. And all that is administered under the Food and Drugs Act. During the Second World War, when people were getting pneumonias and so on, and the infections were quite serious, and the only drugs at that time we had were sulfonamides. And they were wonder drugs of those days. They were very hard to take, very hard to swallow, large pills. Somebody came up with the idea that if they could dissolve the sulfonamide into a solvent and make a syrup out of it, then it could be easily drunk. And so somebody took ethylene glycol and mixed. Ethylene glycol is what you use for windshield wiper fluid. They mixed, it dissolved, and they put some sugar, some strawberry flavor, and it killed 38 Americans. Both products were pure, but when the two were mixed, it caused death. That led to the first Food and Drugs Act in 1945 in the United States, immediately followed by Canada, the same thing. That all drugs, anything that's given, anything is artificial, must be tested in living animals. And the amount of drug that was given, it should be brought up to the point where it kills animals, and then you work your way back to say what dose can be tolerated safely by humans. Thousands of babies, thalidomide babies, are born. So the Food and Drugs Act was again revised in 1967. And now the requirement was that anything that is to be sold and given to people must not only be tested in living animals and must not only be pure and tested in living animals, but it must be tested in pregnant animals also. Because of these very heavy restrictions, they cannot invent new things. It's too restrictive to produce and invent new allopathic medicines. Every year there are now huge outbreaks of E. coli poisoning, E. coli infections, Campylobacter, Salmonella. Every few months they recall meat already sold, meat already consumed, and then they say it's too late, but too bad, some people died. 2 days ago, McCain, it was their product that caused listeria infections in Canada and killed 22 people. Where is it coming from, these infections? They admit, the inspection agencies admit, we don't know. US FDA admits they don't know. What is the purpose of these MPs? They come here and make statements and go away, but they haven't listened to what we were saying, what the problems were. So they don't even know which side, how would they vote on it if they don't even know what the background is. Anybody possessing products, transporting products, holding products, selling products, giving away products can be sent to jail. I'm only talking about the science and regulatory aspect of it. What is involved here, what the motive is, why they want to do it, and then they want to control everything that is produced. And everything in the future, as far as food, drugs, health are concerned, will be produced through genetically modified crops or animals. This meeting is not good enough. We're going to have to take it to churches, homes, communities, wherever, for people to understand what the big government and the industries are up to, where they're taking us, and what can we do. And we must do something about it. Thank you.